Step 1, perform hand washing. Hand washing deters the spread of microorganisms. Close na. Step 2, gather dolled equipment needed. The weight scale, gloves, tape, tongue blade, percussion hammer, stethoscopes, and your water-soluble pads and tissue cotton and tape applicator. Identify client and explain the procedure to the client. Hi sir, I am your midwife for today, and I'm going to demonstrate or to give you a head-to-toe assessment. Can you please state your name for me, sir?
Okay, back.
Where did you live? How old are you?
I'm from Melbourne.
Okay, sir. Instruct the client to undress and put on a lab gown or patient's gown, and then ensure the client's privacy. Then measure the height and weight of the patients and take a vital signs and blood pressures, and then observes client's general appearance, skin color, obvious lesions, dress grooming and personal hygiene, postures, gait, or motor activity. Can you please stand up, sir, and have a kilo for yourself here? .15. Ample bowl.
I'll put that thing down.
Like this. You're 170 467. And the next procedure is conduct the physical examination starting from the head. So we're gonna check your hairs, sir. Check if there is any dandruff, lesions, or something that hidden in the scalp area. So what shampoo did you use, sir? Are you using any dandruff shampoo?
Yeah, head and shoulders.
Head and shoulders?
Picture sa siguro.
Alright, there's something dandruff on your hair, so you can have another shampoo if you're not suitable in head and shoulder. Otherwise, you can have a lot of dandruff. proceed to the next procedure. And I'm gonna check your skull. Your skull is, there is no any obstruction in your ears or your skull. Your skull is symmetrical. So, can I check your eye? Can you follow the distance? Can you follow the lights where it? No. Okay. Can I check your nasal? Your eyebrow? Your eye color? Yellowish. So you're drinking or you're smoking?
It's smoking.
So do you have any cataract before or some did you have any medication in your eye? So until now you're not using reading glasses, eyeglasses?
I do.
You do? For how much? Do you have any grade?
I think 1.5.
1.5? 1.5 grade. So your eye, you're using eyeglasses. Grade 1.5. Alright. So did you smoke?
Yes.
Okay, can I check your ear? Because I need to check your ears. So your ear is quite good. Yeah, it's clean. And there is no some mucus. You hear loud and clear what I say?
Yes.
So I'll checking your face. So can I check the jaw? So his face is symmetrical. I cannot see any rashes. His skin is white and blooming. So he's feeling good today. So his throat, you feel something on your?
No problem.
Can you swallow? There's no distraction.
No.
Thank you so much for that. I just have to check, sirs, if you have tonsillitis. Can you open your mouth for me? The vocal is good. The lips is pinkish, but your teeth is some kind of. So you had something. Did you went to the doctor to check this two tooth? So you are using a artificial teeth, postizo?
No.
No. Thank you so much for that. So I will note your teeth has a, what do you call with this tooth here at the lower area.
Broken. Yeah.
The
Okay.
you have tooth decay. Tooth from the lower, you have tooth decay. Lower. Did you experience some spitting of blood while you're brushing your teeth? No. In between the last or second tooth, 1, 2 on a second. 1, 2, and 1, 2, 3. There's no tooth here. Black. Did you have some cleaning on your tooth or teeth last month?
Not
So your teeth
not
is
bad.
yellowish because your teeth is yellow.
Yeah.
The tooth is yellow. It's because you smoke, right?
Yeah.
You're smoking. Alright. Just proceed. If we can I close your other eye? Close. Can you read this one? If you can read.
Yes, which line? Line 7, FELOPZE. More? Line 8? DEFPOTEC.
Then the second eye. Left eye.
Line 9 is LEFODPCT.
Good. Perfect. Thank you so much for that. So, sir, can you please smile for me? Yeah. Can you please frown? And then bubble like easy peace. Like that. Thank you so much. For skate bag, for Sir Kate bag, he's not distressed. He's just he has a good mood today. Am I right? Inspect the face, observe facial features, inspect, note the symmetry of facial movement by asking the client to make facial movements and to frowning, smiling, puffing out the cheeks and wrinkles. So we're done with it. So we'll just proceed to the eyes. The eyes is round. The eyes sclera is white, yellowish. And yeah, it's pinkish down there on the eyelids. What about the upper eyelid? It's pinkish also, so there's no problem with the eyes. After that, I need to inspect and palpate palpable conjunctiva by inserting the lids with the help of the cotton strip applicator, and inspect areas around the lacrimal glands. So I just have to inspect your throat as well. The near vision of the client, and then position the client to 20 feet from the Snellens or E-charts and ask him to read each line until he cannot read the letter anymore. So I'm done with that. I just have to read the book or let him read something if he can read in a near. Can you read this one, sir? In nearsighted?
There I can. Yes. We soon settled in and enjoyed the work of the college.
What about here? Okay, you are nearsightedness. You are not farsightedness. So your eye.
That's still recording.
Yeah, I still have to record this because your eye is. You have the kind of eye that is nearsightedness. So, your cornea is good as well, so there's no problem with that, the cornea. And the next is, I just have to check your nose, your nasal, okay? Then your shape, lip, and discharges. There is any no discharge, sir?
No.
Alright. So I can't see any discharge with the nasal. There is no nasal conjunction. It's normal. And after that, I just have to inspect the edema, inflammation, and excesses, drainage, redness, swelling, growth with the use of speculum. So I already checked the throat in the inner mouth of my client. So I'll just proceed to the mucosa. Your mucosa is good, yeah, done. And gingiva tip is just a little bit yellowish because my client is smoking. The saliva glands opening is good using the tongue blade and pen light. Already done with that. And then with the globe hands, inspect the palpate the tongue for color of moisture, size, and textures. So I'm done with that because I see that my client's tongue is pinkish. There is no any, the mucus is clear. There is no yellow, whatever. And of course, there is no tonsillitis because I can palpate that he doesn't have any tonsillitis. There is no tonsillitis. Did you feel something bad on here?
No.
No. Alright. The vocal?
Good.
A little bit husky because you smoke. Alright. Your vocal is husky voice. So, you drink any medicine for that? On your vocal? So you only use one drug medication, which is on your lung?
No.
No, nothing? Only vitamins, carbocysteine. Alright. And then next is assist the ears. I already done assisting the ears. The ears have no mucus or tragus or babule. The size is symmetrical. The shape, the position. I observe there is no discoloration or any discharges. Then I use my stethoscope and the light or the pen light. I see there is nothing on the canals. And that's all. Then I already assess the neck and palpate from forehead to the posterior triangle of the neck of the posterior cervical lymph nodes. I cannot see any or touch any nodes. I'll already palpate the ears and the back of the front under the chin of the anterior triangle of the anterior cervical lymph nodes. And I already palpate the left and right carotid arteries and auscultate. And I just had to auscultate him. See if it the fifth intercostal. This one is the second intercostal, the third intercostal, the fourth intercostal, the fifth intercostal. Alright. And the next is, I just have to check your back.
You can take this up.
feel any? No. Just have to check here first. Can you? Normal. Can you breathe for me and say, can you breathe, exhale and inhale and exhale? Alright. I did not even hear something on you while you're breathing. Can you breathe me again and say 99 for me?
99. 99. 99. 99.
Alright. Thank you so much. 99. Okay, I just have to check the lung, the thorax. First, the thorax. Okay. Here. I just have to palpate if it is there's a something, nodules or whatever. And I just have to check your lung sounds. It's normal. Can you please take a breath with me? Inhale. Exhale. Inhale. Exhale. Then inhale. Exhale. Alright. Perfect. Inhale. Exhale. Inhale. Exhale. Inhale. Exhale. Inhale. And exhale. Inhale. And exhale. Inhale. Exhale. Inhale. Exhale. Alright. Good. I cannot see any. Your breathing is good. Actually, I can't hear any loudness of your lungs. Actually, it's good. And I just have to say, yeah, I just have to palpate your back if it's good. Following a move sequence. So I just have to palpate the sensation with the fingers. I just have to do the, what do you call this? Auscultate you using my two fingers. Yeah, that's good. To each area, assess corresponding areas for symmetry and vibration. Place your hands on the posterior chest with your thumbs at the level of T9 to T10. And press together a small skin fold. Observe the movement of your thumbs as the client takes a deep breath. Focus 4 resonance tones starting from the apices of the scapula and across the top of the shoulder through the intercostal spaces, across and down until the lateral aspects of the bases of the lungs, comparing to the two sides. So, ask the clients to take a deep breath and to hold his breath until you are toes percussing from the scapular line 17 to the intercostal spaces, and then percuss downward until the tone changes from resonance to dalnesa. Auscultate the posterior thorax as the client slowly and deeply breathes in through the mouth. Auscultate the anterior thorax, then the aortic, second ICS, 5 external border, pulmonic, and second ICS, second ICS sternal border, tricuspid, fifth external border, and the mitral port, ICS, and mid-navicular line. Check your axilla. There is redness. Okay, there is no any redness on your axilla, and your breast is good, and yeah, you don't have any skin lesions or rashes or edema. Yeah, good. Now I'm gonna check your abdomen, or if you have a gastritis or whatever. Alright. There's no sounds, or can't hear any sounds, or trembling. Good. Your abdomen region is good. The shape and size is round. Measure, and then I observe pulsations and peristalsis. It's good. I also auscultate the quadrant for the vowel sounds, vascular sounds, peritoneal friction, rub sounds, and I also perform percussion on the right lower quadrant, or RLQ, starting on the mid clavicular line, going downward, and then I repeat the procedures on the other sides already performed. And tenderness, beginning with the non-tenderness quadrant, gently depress 1 cm in the dripping motion. Remove fingers and move. And I already moved to the areas. I already palpate the kidney and each sides of the abdomen. I already palpate for the liver on the right part. And put on the body, palpate for the spleen on the left side. Where's the left? Here. Here. Palpate for the spleen on the left side of the body. Palpate for the spleen on the left. Palpate the umbilical area for swelling or the bulges or muscles. I can't even touch any muscles. Do you feel some ache here? Alright. Then I already assess the upper and lower extremities. Expect the muscles for size and the tremors. Inspect muscles and tendons for contraction. He corresponds all of the assessment. Thank you so much, sir. You can now have the seat. Inspect each breast and axilla while the client's hands are resting on his sides, placed on the hips, and lastly above the head. Note the presence of any skin lesions and observe the overall skin tone of the breast. Inspect the areolas for color, size, shapes, and textures. Inspect for retractions and dimplings of the areola. Inspect client's raises his hands, presses them against the hips, and presses the hands together. Okay. Can I press your hands to fingers?
Okay. Ikaw daw, sa mga oras mo.
Dali ako rin.
Wala mo ka naman.
What happened to your hand, your fingers? Or...
Smoking.
Alright. So,
My joints.
like this. Alright. So we're done with the assessment, sir. You can have seat. Have a wonderful day.
Thank you very much.
Perform hand hygiene. Thank you,